I like the Peppa the Pig.
Thank you.
So welcome, Bahadir Cakmak. Bahadir is working for Sandoz International. Is a global portfolio pipeline manager responsible for solid oncology and gastroenterology TAs based in Holzkirchen, München. He is responsible for idea creation, selection, allocation, and for all milestone activities until execution of new product opportunities. So let me welcome Bahadir, and he will tell us something about product evaluation in generic business in oncology. Over to you, Bahadir.
Thank you so much. Thank you so much. And thank you everyone actually right now who is still watching their PC screen. And I saw like 50 to 60 people actually actively checking this slides and this seminar. And happy to actually be in here as well. Thank you very much for re-inviting me for this seminar, because last year I was also in London, but in that time, actually technically, personally, I was in London. Hopefully next year, this COVID pandemic situation will be ended and we will see each other again face to face as well. So I guess I'm the only person who is representing the generic business in this seminar or in this workshop, let's say. If there's any other people around as well, please just write in the comments part, because I saw that mostly the things that today we discuss is this portfolio and project management and how to deal with the people, what's communication. These things are more actually common in actually both in generic and originator perspective. But at the same time, generic world is a bit different world than the originator's life, let's say, the business life, daily life. And today I would like to actually present to you how we make the product evaluations, how a pipeline manager, a global pipeline manager is working when we select and allocate our projects. First of all, I would like to dedicate this presentation to my mom, because unfortunately she passed away last year. And I'm very happy that she always supports me on this topic. Thanks, Mom. Thanks that you always support me. The next part will be the agenda of today. So it is a half an hour meeting only, as you know. I would like to introduce myself in the first. And I would like to actually always make a similarity and see a similarity between the generic product selection with the life partner selection, actually, because you always actually have some thoughts in your mind, because this is a very important selection for you. So first of all, what you do is you define the potential. That today we will also see it with the potential of your partner. So who is she or who is he? And then the checkpoints, where to focus, what do I know, to make empathy, to understand. And what are the other generic competition, and what will be in the future, and what will be our gain actually afterwards. So we will see each step today, same like generic portfolio selection. And I try to finish the things in 25 minutes, and I will be open for a question and answer session as well. Just want to shortly introduce myself. I'm Turkish. My name is Bahadir Cakmak. And I'm working in this industry almost actually 17 years. And just this year, the time that I spent my career in Germany is more than Turkey, because the first 8 years I was in Turkey. I started from sales representative, then product manager, and then I go to the global role in Fresenius Kabi as a global strategic marketing manager, and then in Sandoz almost 3 years. And I'm the portfolio pipeline manager. So I'm living in München, in Germany, and actually Sandoz is really very, very important actually step in my career. I'm very proud to work in Sandoz. It's a global leader generic oncology company. We're in the chemotherapy part and also for the biologics part. We are right now leading the generic part of the oncology. So we are reaching to 100 countries almost, and also you know that we have also this Novartis Oncology as the originator side of the business. First step, define the potential. So what we mean by the potential, whenever we started to evaluate a project as a generic company, believe me, we even check the products in phase 3 studies. So it doesn't mean for us anything actually that the product is not get approval from FDA yet. The most important thing is what are the potential of the molecules. It can be in phase 2, it can be in phase 3, or maybe just approved or launched. But we should be very quick for the decision, and we should be very actually, let's say, have some numbers in our hand. So the numbers that we need to convince our management, we can say the value potential, we can use 4 different external databases to reach that kind of values. Today I will give osimertinib case in each step, because osimertinib is a blockbuster product right now. As I told last year, it's my favorite product. After working in oncology department almost 17 years, you saw the molecules like the football teams. And for me, osimertinib is really, I'm a big fan of osimertinib, because the first thing is it's the lung cancer indication, and it's just a following of the another actually AstraZeneca's product. Sorry for that. So the thing is, osimertinib, the potential, they launched the product in 2015. The potential of the product in 2026 will be almost 10 billion. So this is very important to understand actually in the first side. 10 billion we are talking about. Right now, the number is 5 billion, 5.5 billion. So it means that we will see double actually value. The potential is really very big. We can see the same database actually in Cortellis as well, or in DRG, or we can also check the company presentations. But actually, frankly, personally, I like the Evaluate Pharma database very much, because it's very concrete. And sometimes it's even different than the IQVIA database, because they are checking the company presentations one by one. After we define the potential, we can define the potential this time as a medical perspective. So like PubMed, DRG, Addis Insight, or Medicines Complete, we can understand what the product means for the medical world, for the medical oncologist, for example, or what it means for our customers. The most important thing in here is, if we know the product well, we can check the details. But if we don't know anything, we can just go to PubMed, and we can even check the comparison reviews, or just a review of EGFR lung cancer indication. We can check the key opinion leaders' opinion, or we can only check the osimertinib's actually things, or afatinib or gefitinib in the same indication. What are their good parts? What are their bad parts? The SWOT analysis. But the first and most important thing is the medical potential. So is it really a very good product? Because we saw the value potential is 10 billion. So each step, we are checking the other step if it's true or not once more. So then we understand the value potential. We understand actually the medical potential, but where to focus? Because it's I'm a global actually portfolio manager. So it's very important for me to understand which scopes I need to consider. There's a very nice and public free database called Globacan, and it is the database right now is 2018. But in this one, whenever you write the name of the cancer indication, you can see the incidence world map on the world map, which scopes had a higher incidence and which scopes has lower incidence very well. So in this case, for example, the lung cancer indication, the North American incidence is very high, Europe high, Turkey is high, China is high, and I can also see Scandinavia part is also high. But what about EGFR mutations? Because this product osimertinib had an indication of EGFR mutations. So not for all lung cancer, but only for the EGFR mutations. To understand this, we can also check IQVIA database. In IQVIA database, it's clear that the other EGFR products, not osimertinib, but gefitinib, erlotinib, or afatinib, what are their sales based where mostly? Actually, in the medical database, we can also see EGFR is more an Asian mutation. But also we want to double check with the numbers as well, and we can see that, yes, it's more Asian, Europe, Asian, in the middle of 70%, 74% in this part of the world. And North America and also LATAM is not the main scope for a generic, actually, company. US should be in, of course, but US is not the main scope. The most important scopes are Asia and Europe, and then US. We should think the things like that. Otherwise, to find a solution for the scopes, we will have some problems, actually. And what do we know about this product? So we check the medical potential, yes, but what are the details? So the Cortellis database is really amazing. Whenever you are using Cortellis, it's also showing you the SWOT analysis. And the SWOT analysis, for example, for this product, we know that this is the only T790M resistance mutation product. So in the others, like gefitinib, erlotinib, or afatinib, there is no actually indication like this. But this is the first one and only approved one. So that's why the potential is very high. And also we know that they have a better actually indication in adjuvant treatment as well, in the early stage mutations as well. But what is the weak part of it then? So then what is the threats? What are the opportunities? You can also understand what this product will be in the future just by looking that kind of database as well. So as a generic player, we are not only making only one-to-one copy of the product, but we would like to understand what is the weakness of the product. How can we make small changes from the customer's perspective, maybe hospital pharmacy perspective, or whatever perspectives are, to make our product even better. So it's not like, the product had a better potential, so we should only copy. No, you need to understand the product. So what do we know? SWOT is really very good to understand. So understand the originator part is really important. So we're talking about Cortellis again. In Cortellis, there is a very good database called development status. So in this one, you can see in which indication, in which territories, in which scopes, in which countries, there are studies, and what is the status of the study, when the study started, and when we expect the study will be ended. So it's very important for us, because if the originator didn't plan for those scopes, as a generic player, we shouldn't even think about it. So this is very important for us, what they are thinking as a development status perspective. The second part, we can easily think about it, the patent situation. In the patent, of course, every company has the patent attorneys or patent department, but it's also good to see from the ARC patent intelligence as well. ARC patent intelligence is a very good database. In this one, you can see all the scopes and the number of the patents, what kind of type of the patent, what is the status of the patent, and what is the actually patent expiry date. In which scope, which patent expiry date we should consider. This is not the database that we just look and actually take an action. Of course, we go to the patent department as well, but it is really important, at least the understanding what it is. The next one is ongoing clinical studies. In oncology, if you have one molecule, it's not only for one indication normally. But in this, for example, osimertinib case, again, and there is only brain cancer indication. There is a phase 1 study, and it's just started, I suppose. So I don't think that this indication will get approved in the coming 3 to 4 years. But it's good that we understand at least there is also one more indication the molecule actually working on. Even though in the non-small cell lung cancer indication, they're a blockbuster, but they still have another actually indication. Maybe they can make their potential bigger. But of course, it's a very early stage. In some of the molecules, we see actually 2 to 3 ongoing studies. Some of them will be suspended. Some of them will be maybe complete the study. This is really a bit actually risky when it's phase 1 or phase 2, but it's also a good opportunity to understand the product better. So we understand the originator from their clinical studies as well. Okay, then right now the product is good enough. This potential is good, the value potential is good, medical goods. We understand their studies, which scopes they want to focus. But how about the generic competition? So will the generic competition will be high? Or the API is it easy to find? Or is there any other generic companies already make some oppositions? If you want to understand and track those things, there's a very nice database called IPD and IPD Analytics. Actually, for osimertinib, it's the NC-1 in US is already gone. So it's easy to track because FDA is very transparent on those topics. As you can see in the generic filer information, there are 2 companies and 3 companies in the first ANDA filer. So MSN is there, Alembic and Zydus is there. So 3 companies already get their approval. And we know that there's nothing we can see in the US right now, rather than this 3 company. In Europe, this is the first part was the US information about generic filer information. In Europe, there is a part called oppositions. So in the oppositions, we can also see which company had an opposition, what is the decision. And it is also a good track to understand if there is opposition, it means that there's a development. So Stada in here and Mylan also seems like these 2 companies is working on this product. So it's good to understand the level of the generic competition, even from these trackers. Right now, I finished this osimertinib part. So osimertinib is a case that how we see the product. And whenever we finish osimertinib or any other molecules, we then try to understand the market until the patent expiration date. So what will be the peak sales? In this case, this is an hypothetical, of course, product. There is no product like this. But in this one, as you can see, we were expecting that in 2032, the potential of the product will be almost $1 billion US. And then after 2033, there is the patent expiry date started in each scope. And of course, US is the main driver, and you understand how it goes. So after this, as you can see, whole market, you know the generic penetration, the price erosion, that kind of things you estimate, because right now we are talking about maybe 15 years later. And after you get the market, you can ask the same question to yourself, what is the gain that you can receive? It's mostly, you can think about which scopes we want to actually launch our generic product, and in which scopes, what will be our actually sales forecast. Because we can also think about the volume, the other players, and also the originator, if the originator is strong in some scopes, some of the generic players are more strong in some other scopes. So we are making a very good forecasting tool in this one and finding the 15 years later, what can be our sales forecast. And after everything is finished, you have the sales forecast in your hand for this product. You actually deep dive, you make it clarify, you focus, you understand the originator and estimate your market, and then you go to a decision with, of course, with the board and with your managers. You need to convince them to go or not to go. So this is the decision you also make for your partner as well. So to go or no go. So to be with her or him or not to be with her or him. So this decision is coming from that kind of databases and that we can actually receive. So this is a very short introduction of how we see the originators world and how we define our generic world in oncology products in the generic business. So I think I'm on time that I can actually receive questions if there's any.
Thank you, Bahadir. I checked the stage. There are no questions yet. Do we also see generic competitors in these databases, like
yes,
etc.?
Actually, some of the databases, like this one, this IPD, you can see the generic players as well. So which company is working with API minute, for example, which one is the DMF holders in US, which one have the oppositions. And there was a database called Newport, and right now it's not existing anymore. You can also see the early API activities, which companies working on API. So it's also a good tracker for you to understand the generic competition.
Thank you. Richard Bainey asks, what metrics do you use for decision making?
It's a good question. Actually, the first thing is what is the development cost for this product? Because as you know, in oncology, some of the products you need to make a clinical studies for with the patients. So not healthy volunteers, but patients. So in this case, each study is very expensive. So if the product is requires patient study, especially in US, then the development cost is very high, and you need to actually understand the sales forecast if it's worth to make this investment. So this is the most important thing that we need to decide. And also, also the possibility that you can develop the product is also very important. Because some of the cases, the API is not very rare, and some of the cases there are some production patents or that kind of things that you need to actually convince yourself first if you can manage to develop this product, and then if the NPV will be positive after the development cost and your estimated sales forecast.
Thank you. And there's one more question from Stefan Gerling.
Stefan.
Stefan, okay. Sorry.
I think from Fresenius, I know him.
Do you cross-check your assumption once product is launched?
The product is launched, you mean the originator or our product? Stefan. Because sometimes we already make the project before even the launch of the originator. If we are so sure that we get FDA approval, we already start everything before. But if you mean our product launching, of course, I mean, it's a bit late to check the assumptions, but for maybe the question is lesson learned question for the next projects, what we learn from we do that, Stefan. So we are checking our sales forecast, what was 10 years back, and what was today's the real life database, and we understand the difference. Or if we have a problem with the development, an API or a production, whatever, that we get these lessons learned actually for the next projects.
Thank you. He just confirmed the generic product.
Yeah, I understand.
Okay. There are no more questions. Thank you very much for your case study.
Thank you. Thank you so much.
So we go on with panel discussion, mirror, mirror on the wall, which is the best project of them all. Balance in the art of the science, balance in the art and science of decision making. So thank you, Bahadir. See you soon.
Thank you.
Bye-bye.
Bye-bye.